Nipple reconstruction after mastectomy involves 2 steps. One step is to create a projecting nipple. The other is to tattoo it to be the desired pigment of a nipple areolar complex. So, in general, I'm not a fan of making a projecting nipple because they only flatten out with time. You can't feel them, they're completely numb anyways. And it creates more scars on your reconstructed breast to do that. So the best solution for most patients who have had a mastectomy that has removed their nipple as well, the best solution to have it reconstructed is a 3-dimensional tattoo. So the 3-dimensional tattoo is not going to have anything that projects out like a nipple, but it is going to create the illusion of a projecting nipple based on shading of the tattoo. So that is what I think looks the best when it comes to having your nipples reconstructed or tattooed. If you do want a projecting nipple, there's a couple ways I can do it. If you still have a native nipple on one side and it's kind of long, we can do a nipple sharing procedure where I remove part of your remaining nipple and use that tissue to reconstruct the new nipple. So that's a great option if you still have one nipple on the other side and it has enough projection to spare. The other advantage of this technique is it reduces the nipple length on the other side so that it matches the reconstruction side better. So it's kind of a 2-for-1 problem solving there. Then another way to make a nipple is to do basically origami with the skin in that location. So by doing origami with the skin, I can create a little nubbin of skin that sticks out. It does require putting more scars on your reconstruction to do that, and then we just tattoo all of that once it heals. Another option is if you're having an autologous reconstruction, meaning I'm doing a latissimus flap or a deep flap or something like that, I can use the tissue that I transplant to your chest to make a nipple that projects. And then of course we would tattoo it at a later date to add pigment. So those are sort of all the options for nipple tattooing. You can have a 3-dimensional tattoo, which involves really no actual projecting skin nipple reconstruction. Or we can do a projecting nipple reconstruction using tissue. You're still going to require a tattoo to add pigment. But the ways that we can add a projecting nipple after mastectomy would be nipple sharing from the other breast. We can do little origami techniques on the actual reconstructed breast, or if I'm doing a flap, I can transplant extra tissue up to that area to reconstruct a nipple. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.